These students represent a group of diverse learners. By looking at each student, you probably wouldn't be able to tell which ones have attention deficit hyperactivity disorder, also known as ADHD.
ADHD can be legally defined as a problem involving a lack of attention, overactivity, impulsivity, or a combination of these symptoms. For these problems to be diagnosed as ADHD, they must be outside of the normal range for age and development.
Students with ADHD often have trouble staying focused, being organized, thinking before acting, and remaining physically and/or verbally peaceful.
To be clear, the diagnosis, name, and description of ADHD has changed over the years. ADD, or Attention Deficit Disorder, is one of three types of ADHD currently called predominantly inattentive type ADHD. Children with this type are bored easily and have difficulty staying focused, but hyperactivity and impulsivity are mild.
The number of individuals diagnosed with ADHD has changed from 2003 to 2016. In 2013, the APA reported that 5% of children had ADHD. According to a parent report in 2016, 9.4% of children aged 2 to 17 years old had been diagnosed with ADHD.
One of the major signs and symptoms of ADHD is inattention. This can mean that the child is easily distracted, appears to not listen when he or she is asked to, fails to complete assigned tasks in class, avoids activities that require sustained focus, and frequently loses things.
Another warning sign for students with ADHD is hyperactivity. Students displaying hyperactivity exhibit restlessness, frequent talking, fidgeting, and attempts at multitasking.
Third major sign and symptom of ADHD is impulsivity. Students that are impulsive demonstrate recklessness, may appear impatient and have difficulty waiting their turn, intrude on or interrupt others' activities, are disinhibited in social situations, and may blurt out answers to posed questions before it has been completely asked.
Both children and adults can have ADHD. Symptoms include insomnia, forgetfulness, disorganization, mood swings, and hyperfocus. It is common for children to display behaviors of inattentiveness, impulsivity, and hyperactivity. During development, children normally grow out of these behaviors. However, children who have ADHD do not grow out of these behaviors.
It is important to note that individuals with ADHD cannot control their symptoms. However, their symptoms can be successfully managed through a variety of treatments and resources from healthcare providers, therapists, teachers, coaches, and other family members, all of whom can ensure that individual's success. There are several tips and strategies that can be utilized when teaching students with ADHD. One tip is to post and review a list of simple rules that tell students what they need to do, not just what behaviors to avoid. Leave it in an area close to where the student sits to help trigger a specific behavior.
A little encouragement goes a long way. Teachers can modify the length and/or content of assignments to reduce off-task and disruptive behavior. Giving immediate praise to students upon a successful completion of assignments or after targeted behavior is shown to yield positive results.
Teachers can also provide students with task choices, where students can choose from several assignments regarding the same specific academic skill. Studies have shown that students with ADHD who are provided task choices are more engaged in classroom tasks and thus reduce classroom disruptions.
Instruct students to evaluate their own classroom behavior and work performance using a Likert scale system, wherein students assess whether they agree or disagree with a particular statement. Teachers should also evaluate their students' performance. This has been very effective for students with milder levels of ADHD.
Encourage student participation in class and use audiovisual materials such as computers and smartboards as valuable tools to keep students engaged and focused. Computer-assisted instruction programs can also be used to highlight important material using simplifying tasks and engaging game-like formats.
Teachers should regularly monitor and check students periodically throughout the class period. Students with ADHD can become easily distracted. It may help to be physically near the student during class time.
Since using stimulating medication rarely addresses the multiple chronic difficulties that students with ADHD face, interventions that directly address academic skills can make significant differences and can include explicit instruction, audiovisual assisted instruction, and peer tutoring.
Parents can work with schools and medical professionals to determine whether their child has ADHD or if there might be an alternative reason, such as ineffective parenting practices or inappropriate academic settings. By collaborating with licensed professionals, parents can ensure that their child has early interventions rather than letting the issue get worse.
Thank you for listening to our presentation regarding ADHD. We have provided a list of sources for your reference and encourage you to learn more about ADHD through these and other resources.